Welcome to Hope in the Face of Cancer, where we share real stories of courageous people in their cancer journey. Today, we're honored to welcome a leader whose career has been rooted in compassion, courage, and care. Dr. Jacqueline Brock serves as Executive Vice President and Chief Nurse Executive at Harris Health, where she brings more than 30 years of nursing experience to the people and communities she serves. Her journey has taken her from the front lines of nursing to leading clinical education in healthcare, and now guiding the future of nursing at Harris Health. Every step of the way, she's been a champion for patients, nurses, and families while always putting people at the center. Dr. Brock brings her compassion beyond the walls of Harris Health to our cancer community as a board member of CanCare and a member of our Healthcare Advisory Council. In today's conversation, we'll hear her reflections on the moments that shaped her, why she believes in building a movement of hope, one active care at a time, and we'll share a surprise announcement later in our conversation. Jackie, thank you so much for joining the show today.
Thank you. I'm honored and very happy to be here.
We're thrilled to have you. Lots of exciting things to talk about with our audience today, and you've had such a storied career in nursing, and I would love to kind of start there. Like, what prompted you to pursue nursing? Where did that passion come from?
Well, my mother was a nurse. So that really is kind of what got me pointed in that direction.
Mm-hmm.
I was able to see through her career and the work that she did, the impact that she could make on others' lives, and how much fulfillment she got from that work, and the commitment that she made to that work. Then later, when I met my future husband, his mother was also a nurse.
Oh,
So
wow. A family affair.
as two leading examples of nurses who kind of blazed the trail for me. And
wow. So you probably, you kind of decided as a young person, growing up that was what you were going to do, or did it take a little later in life before you decided to make that your calling?
It took a little later. After high school, I took a couple of years to try to change my major every semester.
I resemble that.
2 or 3 semesters to try to make sure. That's what I thought I wanted to do, but I wanted to test and explore to make sure. Because even then, at that early age, I realized that being a nurse was not just something that you could do as a flight of fancy. It wasn't something that you could just pick up and take off with. It had to be something that you're truly committed to. So I really wanted to make sure. Looking back, it seems like a really smart, mature decision to do it that way. I don't think that was really a factor at the point. I like that it looks that way, but I think at that time I just wasn't really sure. But after a couple of years of doing that, changing my major every semester, that's when I decided, no, nursing really is the only thing that truly appeals to me that I can even imagine doing for the rest of my life. So went down that path.
Wow, that's awesome. So as you think back to nursing school in those early years, was there one component of nursing that just kind of sparked you and, really solidified that, wow, this is it for me?
Yeah, it was in my final semester of my 4-year program. And that's when we went into critical care. When I walked into the ICU, it felt like I belonged there. It felt like that's where I was supposed to be. And I just had an affinity for it. There were some of my classmates that they didn't like it at all, and they would stand on the wall and, just wait for that rotation to be over. And on the very first day, I was engaging with the physicians, helping insert catheters, doing things that, just really enthralled me to be involved with patients that were that critically ill, and knew that every intervention that we made such a difference. So I really thrived on that environment. And I do remember the very first day I walked into that environment, I was like, this is it.
Oh, wow. Yeah, that's amazing. Yeah, and just knowing that you had such a substantive difference in every life that you touch, that's pretty powerful. And in that time, you worked with oncology patients too. That was your first exposure, right, to oncology patients as well, right?
Right. I worked, my first job was in the surgical trauma intensive care unit. And we, even though that wasn't our primary patient population, of course, Those oncology patients would have complications. Sometimes there's surgical procedures would land them in the ICU. They would end up in the intensive care unit. There were sometimes post-op, they may have a reaction to a medication, but because they had had surgery, they ended up in that surgical ICU. So I did begin to have exposure in that environment, and was really the first care that I had to learn to provide to the cancer patients in critical settings, in the critical care environment.
Yeah.
So we had to learn not just around the interventions that we were doing to try to correct either the reactions or the extreme difficult surgical response they had, but also to understand the impacts of their chemotherapy, their radiation, their other treatment, and how it influenced the care that we had to provide.
Mm. So was it really different caring for oncology patients than other ICU patients? More complicated, or?
I would have to say that it wasn't different in the fact that, we did multiple, sometimes very complex, complicated interventions for multiple types of patients. So it wasn't different in that regard. I think what was different was the patient's experience, because most of these patients had been exposed to medical care and been exposed to prolonged medical care in some circumstances, some situations, which many of the other patients we took care of were acute surgical or acute trauma patients. And so their experience wasn't the same. But those cancer patients really brought with them, I guess, a different package of their experience and what they had been through. Which I do recall many of the patients that I dealt with that had that oncology background, how impactful that was, because understanding the journey that they had been on and the long and difficult road that they had passed, and that this was one more step on that journey and one more phase on that journey. And I would say the vast majority of them, their attitude, their resilience, their commitment to doing their part in getting better was always inspirational.
So you witnessed, obviously, not just the physical care, and were part of the physical care, but I would imagine, especially with those oncology patients, you were witness to the emotional part of their journey as well. Tell us a little bit about that for you.
Yeah, with every patient, honestly, but the oncology patients in particular, like I said, because their journey had often been more challenging and long. And when I encountered them in an intensive care setting, it was significant for them. And their whole care team. It wasn't just the patient, but the people that had been caring for them at home, the people that were going to care for them when we got them out of there again, get them back home. And everybody that was so invested in that, they're just the emotional commitment, and you could see the toll that it took from all of them.
Yeah.
But you could also see the support that each person provided to the patient, and the patient was always really the center of it. At least it felt to me, it was always the center for us in that acute hospital ICU setting. But just knowing that all of the energy and all of the positive vibes and all of the best wishes were always directed at that particular patient. It could have been an extreme emotional drain, because if you just started thinking about what these patients had been through and what their diagnosis was, and if you even just started thinking about what their chances of survival of this visit, much less long-term, it could be very emotionally draining, taxing, and just, depressing. It could have been. But I would say, like I mentioned before, the vast majority of these patients just demonstrated such a strong sense of resiliency and will to live that for me, it was uplifting to me.
Yeah, it's like fuel.
Part of that, to be able to do my part to help them be successful in their fight. So it could have been horribly taxing, draining, and emotionally traumatic, and it generally wasn't.
Yeah, it kind of makes you want to root for them, seeing, how they're fighting. And it's like, well, I'm going to fight even harder for him now. Yeah, I
Yeah.
love that. So along the path, you also have had personal experiences with cancer in your family. Tell us a little bit about that.
Okay. In 2003, I actually had worked 14-hour shift in the trauma section of the emergency department in a hospital in Dallas, a level 1 trauma center. And I got home late that night, had just sat down on the couch to eat for the first time that day, and the phone rang, and it was my mother, who lived about 45 miles away, and she told me that she was going and be admitted to the hospital in another town the next morning to have surgery because the sore throat that she had had for a couple of weeks had come back. The test results had come back, and she was pretty sure she had cancer. But she was going in the next morning to have this lump removed, and we would know more after that. So that was the initial introduction to my mother's journey in cancer, that I was lockstep with her from that moment on. So I arrived at the hospital about the time she did the next morning. And yes, it was cancerous. The surgeon came out of the OR and told us that it would be 10 days before the pathology came back, but he's seen enough of these masses to know that to his naked eye, it was cancerous. And so he was making a referral to the oncologist in Dallas, where I was living. So that was helpful. So my mom came home with me, and within 2 days, we had her appointment and started the long journey. She had non-Hodgkin's lymphoma. And on the first PET scan, all you could see were the lymph nodes. It was diffuse everywhere.
Wow.
But she responded well to therapy. But it was complex and complicated. She ultimately died about 4 months after that from a ruptured abdominal aortic aneurysm, but had responded well to her therapy and had done well through her cancer journey. And it was interesting because, as I told you, my mother was a nurse. So she did not want to die from long, lingering, protracted, pain and just debilitating cancer that she had seen so many times in her career, in her life. But she did get to experience the other side of healthcare, and the fact that there had been so much progress and so much advancements. And it wasn't like it was when she was caring for these patients at the bedside. And so she didn't have the experience she was afraid of. So I was extremely grateful that we were able to show her a different level of care and a different level of treatment than what she anticipated. And I can tell you that she never had one moment of nausea. That was one of her greatest fears. She told her doctor that on the first day. And he made sure she was never sick. And I know that's possible for every patient, but for her, that was her number one ask and her number one fear. And I was extremely grateful that she never experienced what she was most concerned about.
Yeah. Well, cancer continued to touch your family after your mom. Tell us about that.
So in 2017, many years later, my sister, who was 8 years older than me, had been suffering from some significant pain in her pelvic area. And she lived out in Nevada. So I flew out to see her and could tell that something was not right, not just the pain, but she had lost some stature, she had lost weight, so made the decision that she needed to be seen somewhere significant, University Hospital. So she chose to go to Salt Lake City University Hospital, at which time she was diagnosed with multiple myeloma, and fought a very valiant battle for 3 years. She ultimately passed in the fall of 2020. But she had a a stem cell transplant during her treatment, which gave her a couple of years of good life in between. Yeah. And then when it returned, it kind of came back with a vengeance. But
yeah.
Again, she also had excellent treatment, phenomenal care, frontline, cutting edge, research based. It was absolutely outstanding. And as with my mother, I was at every appointment, every treatment. And as the nurse in the family with my mother, we used to laugh all the time of like, how do people navigate these systems if they're not nurses? My mom was like, I have my own master's prepared nurse hand in hand with me at the moment. It's hard to get through the system. And so that's when I began to recognize and learn how truly challenging it is. And then, so when my sister was diagnosed, I made it a point, and was very fortunate with my employers. I had 2 employers over that period of time that both were very accepting and allowing me to go to Salt Lake City to be there for the treatments, to be with my sister, to work remotely when I needed to, so that I could be that caregiver that could sustain her and family.
Yeah. Being the caregiver in those scenarios and knowing what you knew as a nurse, how did that caregiver experience change your perspective, if at all, about healthcare and what you do for a living?
Like I mentioned back with my mother, it's the first time I truly realized how complex and convoluted our health system is. But to help my mother navigate that, I learned a whole new appreciation for what our patients and their families go through, just from trying to get from one appointment to the next. And making sure that you have the right medication in the right doses at the right time, and that your doctors or specialists are talking to each other, and that you're not getting conflicting information. I mean, I carried a notebook around with me that I wrote everything down in, so that I knew exactly who said what on what day, But I think that was because of my background as a nurse, that I innately knew I needed notes, because we don't do anything in our career without notes.
Right.
But most of our patients on average don't know that. Yeah. So I tell you that what I do now is I teach my patients, started teaching my patients now, that I teach my nurses to teach our patients that. And any family and friends, I teach them, write it down.
Yeah.
Because you'll think you understand, and then you're stressed, you don't remember, you can't recall, then you get confused, and then you get frustrated. And so, that's truly with my mother's illness is when I really, until then, I didn't appreciate how complex and complicated our healthcare system is. I was ready for it when my sister's illness came along, so I was more prepared in advance, but I will tell you, it was still complex and complicated. Yeah. And interestingly enough, the more resources they push at the patient, the more complex and complicated it gets.
Yeah. So true. It's so true. And someone like you who knows the system, it was a challenge for, can you imagine, just someone who hasn't, interacted in the healthcare community, how complicated it can be. So I love that advice, just write it down, especially because there's so much emotion going through any given moment, during the treatment journey, that it's hard to just keep track of everything. So great documentation, maybe having someone with you, if you can, who can be that extra set of ears, and to take those notes for you, could be hugely helpful as well.
And I think that advice is valid, and have used it and given it to many patients, not just oncology patients, any patient.
Yeah, absolutely.
If you have hospitalization or you have consecutive visits, write it down.
Yeah. Yeah, that's great advice. So today at Harris Health, you are shaping care at a whole huge system level, supporting the nurses, overseeing nursing at Harris Health. So Tell us a little bit about that and from that leadership lens. What does it look like to support the nurses, prepare the nurses to provide the best care to their patients?
So I will start by saying this is the most fulfilling role I've ever had, in the fact that being able to remove the barriers so that the nurses can be who they already know how to be, want to be, show up to be every day. My job is to make that as feasible and easy as possible. And to know that I can make a change or implement a process or help procure a piece of equipment that they can utilize to better care for their patients, that really is what keeps me going every day. Our nurses don't need me to tell them how to take care of our patients. They have that innately in their heart. That's why they're here. They are truly committed to providing excellence in nursing care to our patients, going above and beyond every minute of every day. They are asked to do more with less and do it over and over again. I am routinely surprised and amazed. So I just try to step up and do my part.
Yeah. Remove the barriers. Yeah.
Remove the barriers. Try to help in any way that I can to make it as easy as possible for them to do the work that they are destined to do. And the way that I look at it is, what I want nursing at Harris Health to be is the place that every nurse wants to work, that they want to be in this environment, because we have made it possible for them to function at the level they need to function to be able to provide the care they need to provide the best outcomes possible for our patients. If I can help create an environment that makes that happen, then I've done my work for those patients.
That's awesome. Yeah. And you're supporting the patient being at the center, and you're supporting the patient getting the best care by giving the nurses, what they need when they need it. I love that. That's beautiful. So when I think about nursing, often hear it talked about as like the art and the science, right? How do you look at the role of the nurse in the emotional support side of the equation, whether it be for an oncology patient, for any patient, because it seems to be the closest people and the people that the patients see the most. So they're probably getting so much more exposed to the emotional journey of that patient than anybody else on their care team.
Yeah, I agree with that. And I'm glad you mentioned the art and the science of nursing, because, the science part is often what is most visible and honestly critical. You've got to have the science of it to be able to save a life and, understand the medications and make sure you're not doing more harm than good. So that is essential. But it's the art of nursing that I really think does get into the emotional component. And one of the biggest pieces of that art of it, at least for me and in my experience, is being able to assess in the moment who your patient is and what they need, what they most critically need, not just meds, not just water, not just, but from an emotional standpoint, emotional perspective. Sometimes they just need somebody to sit at their bedside and talk to them. Sometimes they need somebody to hold their hand. Sometimes they need somebody that's going to walk down the hall with them to the treatment room that they've got to go to. Or, sometimes they need somebody to make that call to their family to ask them to come to the bedside. Being able to understand where your patient's at on their journey and what they need from you in the moment is really where I think the art of nursing comes in. And then being able to sometimes muster the strength to deliver what that patient needs. Seeing it, recognizing it is one thing, and then being able to step into that gap and provide that emotional support, that psychosocial coverage, that, sometimes simple things, sometimes bigger things, but being able then to fulfill that is carrying through on the art of it, the recognition of it.
Is that teachable, or do you have to find people who just have that innately in them? Because you can teach them the science part, but can you teach the art, or is it just something that you have to select people who have that intuitively?
Well, I might be a little naive in this regard, but I like to think that most humans have some intuitive degree of compassion for their fellow man.
Yeah.
So I don't know that you could, if you don't have any compassion, I don't know if I could teach you that.
Yeah.
But if you have that small seed of compassion, then I do believe you can be taught how to grow that, how to manifest that, how to demonstrate that in ways that are more or less impactful. And then the other part that I think has to be taught is how do you manage that? Because it can be all consuming.
Yes.
You have to learn how to take care of yourself in the face of taking care of others. And, I know it sounds a little trite, especially to people that haven't done this, but to say that you give a piece of yourself to every one of those patients, it is true.
Yeah.
So you have to figure out how to regenerate that in yourself. There's only so much you have to give, but you have to refill that so that you can give more. So learning, that is something you must learn.
Yeah.
Some people are better at it and it's more innate to them, just like some people are more compassionate, more empathetic. It comes easier to them. But I do think everybody can learn both to give and to refill and to rejuvenate. Honestly, you have to learn how to take care of yourself, because you can't continue if you don't learn how to do that regenerative self-care.
Absolutely. I mean, we talk about that when we train survivors and caregivers to be volunteers, because, these people are so focused on caring for others and they want to support the other person, but it can be very emotionally draining. And so it's that fine balance of giving to someone else, but you can't give what you don't have. You have to refill your own bucket. It's like putting your oxygen mask on first, right?
That prime example. That's exactly it.
That's right.
But yes, I do believe if you have that kernel to start with, you can teach and help that grow and flourish, and become a more dominant part of the individual. But you've got to have that core piece. But honestly, I'll have to tell you, I've never met a nurse that didn't have it.
Yeah. They probably wouldn't be attracted to the profession if they didn't have it.
No, yeah. I don't know how, and I don't know how you even make it through school if you don't have it.
Yeah, because something deeper in you has to drive you to do what you're doing.
Yeah, I've never met a nurse that doesn't have it. I've met nurses with varying degrees of it, but never somebody that doesn't.
Yeah. Okay. That's good. So, pretty early in your journey with Harris Health, you were introduced to CanCare.
Yes.
What attracted you to join the board of CanCare and to choose to give of your precious time, because you're a very busy woman, to this organization? What was it?
I think it was really the opportunity to continue that journey that I started with my mother and my sister.
Yeah. Yeah. Tears are welcome here. We're an emotional support family. So
yeah. Because losing both of them could have ended my relationship with cancer.
Yeah.
But this gave me an opportunity to continue to give, continue to provide something to somebody in a different way, to support another family or another cancer patient through another mechanism, without it having to be the ones closest to me or the family members closest to me. and it's not to say that, it won't happen again. I mean, it happens
Yeah.
so often and so frequently, but this felt like a different chance, a different opportunity, but a way to continue the love and the compassion and the support that I had so willingly given to my family,
Yeah.
knowing that there are others who need that and may or may not have the family member immediately readily available or prepared to step up.
Yeah, that's so true. You could have easily compartmentalized that and put it in your past, but you've chosen to kind of embrace that pain, but in honor of those coming after them, because your work to me with CanCare is providing the support that people need to help them go through that journey that you so recognized was needed when you traveled that journey with them. So I think that's beautiful. And we're certainly so grateful for your heart and your time and your expertise in this. And so excited about what we are building together with Harris House. So this is kind of an announcement moment because as this episode airs, will be the first opportunity we're publicly sharing about a special partnership that we are putting together. So, would you like to share with our audience what Harris Health and CanCare are doing together?
Yes, I will do my best to share. With this partnership and relationship, we are looking forward to the opportunity to provide the at the elbow support through the CanCare volunteers, well-trained, educated, experienced volunteers to the patient population at Harris Health. That to me is paramount because these patients don't often have access to the same resources that many other patients would have. So the need is tremendous. The need there, I think, is exceptional, and I am so thrilled to be a part of being able to bring this resource and this support to our patients in this particular hour of this particular type of need that they have and face. The other side of that is, as we've mentioned, many of the staff people that work here are extremely committed to our patients and want to do more. So we're also prepared to offer an opportunity for our team members to be able to volunteer to be CanCare at the elbow support volunteers, to participate in the education and the training programs, and then be able to volunteer back to support the patients that they may or may not care for on a routine basis. That oncology care may be outside their area of specialty, but they may have, like me, experienced it through family members or personally, and so want to be able to give back. So we're also offering that opportunity to our team members, to our employees here. And I think being able to share this with both and to address this experience in both ways is extremely important. And as I mentioned before, so fulfilling to be able to give these opportunities in these difficult circumstances, but to provide a tiny ray of hope on both sides of the equation.
Yes. Yeah, absolutely. I mean, our volunteers often tell us they feel like they get more from the experience than their clients do. It is so fulfilling to give back in that way. So I think it's just a beautiful circle that, Harris Health, patients will be able to benefit from that support, but then there's that beautiful outlet, for the staff to kind of put on their volunteer hat and serve in a different way. So we're so excited about this partnership. And from the CanCare perspective, really looking at it as being a testing ground for us to really refine the way that we deliver our services, and then to take that and just share it with the world, because our board, as you know, and you feel this way too, just believes so much that emotional support in the cancer journey is so important, and it's important to your health outcomes. And we're on a crusade to just make that available to everyone facing cancer, and that's our mission, and we're so thrilled to have Harris Health as a part of that. So we thank you for that. There's a research component to this as well. Talk a little bit about that. I mean, you guys do a lot of research in your institution, and tell us a little bit about what, from your perspective, that research will garner.
So this research is really focused more on the emotional outcomes and how that emotional support impacts the patient's overall outcome. And that's what excites me about this research, because it's not a clinical intervention, but it's just as important as any of the medications that we're giving them. And to be able to quantify for our industry, for healthcare at large, that this kind of intervention has X impact on the patient's outcome, be able to publish that, be able to quantify that, be able to see that is extremely exciting to me, because
Yes.
that is really the almost unseen, unidentified, untouched portion of healthcare. It's the science side of what we do is easy to measure. This is part of the art, and to be able to put processes in place that help us put value on this and show that the true impact that it really has. I'm so excited to be a part of that, and all of the people on both sides of this agreement and relationship that are engaging and being part of this. It's thrilling in a way that kind of unique to be able to get this way.
Absolutely. I think no one would say that providing emotional support to our cancer community is a bad thing. They would all intuitively say it's a good thing. But I think what this research will help us to demonstrate is that it absolutely also impacts their health outcomes. And that's what's so exciting to me, is to really validate that emotional support. When you think about treatment for any disease or condition, it's more than just the physical. It's the emotional, the mental, the spiritual. It's the whole package. And being able to really recognize that and value that it's more than just the physical treatment is powerful.
Yes, I agree.
Well, we are so excited, and we're so grateful to you for your leadership in driving this, and to Dr. Porsa, President and CEO of Harris Health, for his support. He was featured in our recent book, Hope in the Face of Cancer, and he spoke about the importance of delivering the right care at the right time. And I loved that. How does that resonate with you in the care that you show patients?
Well, I think it's profound in the fact that we have to see every patient as an individual. We talk about treating populations. We talk about treating patients with common disease processes. We have guidelines and protocols that kind of gives you an outline of how patients in this particular category needs to be treated, or what you expect to see as an outcome if you do X, Y, and Z. But to me, the right care for the right patient at the right time is really about seeing that patient.
Mm-hmm.
Meeting that patient where they are in their healthcare journey, and being able to follow them, help them, sometimes lead them, sometimes let them lean on you, sometimes push them to get them through that piece and part of their journey, and understanding that, yes, we have guidelines, we have protocols, we know what standard of treatment is, but every patient is different. Every patient's needs are different. And to get the patient to the outcome they deserve, that they should have, that they can potentially achieve, requires that we see them, every one of them, as an individual human being.
Yeah. I think that's admirable, especially with the amount of volume that you see and the complexity of what you do. To see that from the top down, the person, the individual being at the center, is admirable and so important. So thank you. Thank you for that. So as we wrap up here today, Our podcast is called Hope in the Face of Cancer. Our book is called Hope in the Face of Cancer.
I like that.
What message of hope would you want to share with our audience today? There could be people who've been newly diagnosed listening. There could be healthcare leaders like you listening. What message of hope would you like to give them?
A couple of things I'd say would be, I think from the medical perspective, as I mentioned with my mother's care and then later with my sister's care, we have made such progress. The level of care, the expertise, the protocols that we have, the medications, the treatment regimens, I mean, it is just phenomenal. It is, and it's getting better every single day.
Yeah.
We haven't eradicated this disease yet, but there are so many resources and so many people that have committed their entire lives to doing exactly that, that I think this shows that I think the compassion that so many people have towards those with cancer and how much we all want to make this better. So the hope that I would hope individuals would hear from that is you're not in this alone. Mm-hmm. There are so many people that care for you. We don't even know you yet. Some of us don't and may never know you personally, but we want this to be better for every single person that's diagnosed with cancer. And there's so many people committed to making sure that that can potentially happen. You don't have to go through this alone. It is a hard journey. Nobody's going to try to fluff that up. It's a hard journey, but there are people that want to help you. They will help you medically. They will help you emotionally. They'll help you psychologically. Reach out. Don't ever feel like you have to do this by yourself. And I think that's probably where the hope lies, is in the reaching out and connecting with someone.
Yeah.
Either done this before, had this disease, or helped someone else through it. So your hope is in help.
I love that. Your hope is in help. I will take that with me, Jackie. Thank you. Thank you for what you do every day, for your heart, for sharing your story and your vulnerability with us, and just everything that you're doing every day to care for our community. We are so grateful for you.
As I said before, I am honored and humbled to be a part of this, and I appreciate this opportunity. Thank you.
Thank you. And thank you all for joining us for this episode of Hope in the Face of Cancer. If you or someone you love is facing cancer, CanCare is here to support you. Visit us at cancare.org to learn more. Until next time, remember, there is always hope in the face of cancer. Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.